I see that we make a lot of mistakes in the industry. We minimize and downplay the importance of data, but make sure that you spend a lot of time understanding who that consumer is.
Hello and welcome to the Shiny New Object podcast. My name is Tom Ollerton. I'm the founder of the creative effectiveness ad tech platform Automated Creative, and this is a regular podcast where I get to interview exciting people from our industry about the future of data-driven marketing. I'm sat here in Diageo HQ in London in their beautiful new office, and I'm on a call with Leandro Chique. Leandro, I don't think I did a good job with your name there, but I tried. Leandro is a marketing director at Philips. So, Leandro, for anyone who doesn't know who you are and what you do, can you give us some background?
Yeah, so Tom, first of all, thanks for having me in the podcast. Like you said, my name is Leandro Chique. That's a very good pronunciation, so thanks for that. I'm originally from Venezuela, born and raised. I worked 7 years in Procter & Gamble in multiple roles there. Then I went to the US to do my MBA and joined Henry Schein doing strategy. That's Henry Schein is the biggest distributor for animal health, dental, and medical in the world. I was doing strategy for Henry Schein for about 3 years, 1 year in New York, 2 years in London. And then 5 years ago, I moved to Philips, where I started my role in strategy, in the cluster, the personal health cluster. And today I'm doing marketing in the oral healthcare business.
Well, that is quite a career and in different businesses and sectors and locations. So I'm curious to know, what was the biggest mistake that you made in that career where you were red-faced, you were embarrassed, you were face-palming like crazy? What was that awful mistake that you made? But in retrospect, you're glad that you made that mistake.
I think the biggest mistake that I made in my life, it was just to take a job because of the money. So not having a plan was something that I paid dearly, and that's something that I advise a lot of friends and colleagues that come to me sometimes for advice. Do not take a job only because of the money that could bring to the table. I know money is very important and we all work because we need and want money, but also make sure that you have a plan. Make sure that you have a vision on why you're taking that role. What is it that you want to get out of it? What is next after that role? I think that's super important, especially for the younger you are, the more that first job that you take is going to define who you are in the future. And that's a mistake that I made very early in my career. It took me multiple years to get out of that situation. So it is very important. Don't get into that golden cage or golden handcuff that exists out there.
So what advice would you have for people who have got inside the golden cage or the golden handcuffs? How'd you get out of it quick?
So I think then when you get into that situation, people is gonna, or senior managers or middle managers that you're gonna have to be doing interviews with, you really need to communicate why is it that you want to do a career change, or what do you want to have, I don't know, switch companies or switch industries. It really depends on what kind of cage you are in, right? And you need to have that story right by the time that you are going to have that conversation. I think that's something, in my opinion, that it can be difficult if you get into the wrong industry or the wrong function or the wrong company. It's going to be very difficult to have that storyline in a very clear and easy to communicate way, right? So my advice is that if you are really in these kind of situations, take time back, relax, really think through what is it that you want to take your career, what is it that you want to do with your life, what sort of industry you want to be in, what sort of functions you want to be in, what type of company you want to be in, because a corporate and a startup are very different. And that would help you to nail down that storyline in a very clear way so you can communicate that as you go through that process of stepping out of that situation that you got into. Yeah. And then if you need to take a pay cut because you already made a decision because of money, so money clearly is important for you. If you need to take a pay cut, you see it as temporary, do the life adjustments that you need to make. But I think for careers, you are here for the long term. You are not real. You don't get into a career for the short term. So get that story right. Be willing to do sacrifices to make up for that mistake, and things will get back on track.
So that's excellent career advice, and thanks for sharing it. But what I want to get to now is, what is your advice for data-driven marketing? What is that killer bit of advice that you find yourself sharing most often that you always rely on?
So to me, data-driven marketing, the most important piece, and I see people forget it quite a lot, is always be consumer or patient or customer centric, right? It really depends on the industry where you are, but make sure that you spend a lot of time understanding who that consumer is, and not understanding from the psychological point of view, but understand who is this person, like use descriptive analytics to define who that person is, or who that business is if you are in B2B, or if you are in healthcare, who is this patient? What are really their problems from the data point of view? And spend a lot of time on that one. I think people, generally speaking, don't spend enough time looking and understanding from the data analytics or data. So how to describe that customer, how to describe that consumer, how to describe that patient using numbers. I think that's very important. I think that's the first one. And make sure that you spend also time really understanding what is the problem that you are trying to solve for. And make sure that you articulate it with numbers, with data, because that not only helps you to do a better job as a marketeer, but it would also help you to communicate within your company when you go to R&D, or when you go to engineering, when you go to finance. You need to be able to communicate in a very succinct and concrete way how you are creating plans or communications or products to solve this problem for your customers, whatever that customer is. And I see, to me, it sounds obvious, but to be honest, I see that we make a lot of mistakes in the industry in this regard. We minimize and downplay the importance of data. We minimize and downplay the importance of being concrete on the problems that you're trying to solve. And then I would also say, after you get that nailed down, start figuring out what other data points are around that consumer or patient that could be relevant for the type of job to be done that you want to do. I think that would be my biggest advice for the new people getting into data-driven marketing, right?
Okay, so imagine I've joined your team and we're launching a new product, and I say, Leandro, I have a really good understanding of the consumer, the pain point that we're solving. I've got data, and then you check my homework. How do you know when I've done a good enough job? How do you know when you've got enough data? How do you know when you've done enough digging? Because there's a lot of data points out there. There's a ton of qual you could do. Obviously, loads of qual with ones and zeros. But do you have a process or a framework for understanding when you've done enough investigation into the target audience?
To me, the way I approach this, I'm very pragmatic, Tom. I like pragmatism because I think that if you're using data to describe that consumer, that patient, or that customer, and you're overcomplicated things, then you're gonna get lost in data. Like you say, like there is a lot of data out there, and there are tools these days, like for example, AI there are more and more tools that you can leverage to get in depth understanding of whatever your customer is. Yeah. But what I look from the people in my team is that they can, in one sentence or two sentences, with data points, tell me what is the job to be done and what are the problems that we're trying to solve for this customer. Yeah. That to me is paramount. So if you get that one or two sentences right, after you did all the research, after you look at all the problems, and you can communicate what is it that we're doing for them, then other opportunities are going to rise, and then all those other opportunities might need additional research and additional data points that you need to look into. But from the pragmatic point of view, I feel that my team is ready when they know our reason to exist, and they are able to communicate it in a very concrete way using data points.
This episode of the Shiny New Object podcast is brought to you in partnership with MadFest. Whether it's live in London or streamed online to the global marketing community, you can always expect a distinctive and daring blend of fast-paced content, startup innovation pitches, and unconventional entertainment from MadFest events. You'll find me causing trouble on stage, recording live versions of this podcast, and sharing a beer with the nicest and most influential people in marketing. Check it out at www.madfestlondon.com. So now we're going to move on to your shiny new object, which is using data to scale and drive consumer or patient engagement to drive behavior change. So that sounds quite self-evident what that is, but can you tell us in a little bit more detail why that's your shiny new object?
Yeah, so this all came because of a project that I did actually when I was in a strategy, specifically for patients. We did a lot of research with post-acute cardiac patients. So these are patients that have a acute cardiac event. So for example, heart attack, right? We have a lot of data about these patients, and this data is siloed in electronic medical records in hospitals. Most of the people today have wearables, like you name it, a Fitbit, an Apple Watch. You also have a phone that has a lot of rich data on what is it that you're looking online, what is it that what sort of apps are you using in your phone. All that data tells a lot about that person. Now, a few years ago, we didn't have enough technology in order to get a hold of all that data, read all that data, make sense of all that data. And these days with AI, I see more and more proof and evidence that you can pull all the data and use it to improve the engagement of a patient and help them to drive behavior change. Yeah. And I wanted to extend a little bit on this and the importance of this. The reason that why it gets me excited is that healthcare costs for us as a society, no matter where you live, no matter where you are, is a huge burden. Huge. We're talking maybe in the trillions, at least hundreds of billions of dollars on inefficiencies in healthcare, and helping people to get engaged with their healthcare and drive that behavior change is going to help us to improve life across the world. And that the perspective that we are on the verge or very close to get into this direction, it gets me super excited. And that's something that I really look forward for the next few years that is going to get there. We're going to get there with the help of generative AI and so many other tools, breaking silos between healthcare data and consumer data. All this movement that is happening around us is going to really drive impact, and I love it. And you call it, a shiny new object. I would like more and more people to help push into that direction because we can have a huge impact in humanity as a whole.
So what is the behavior change that you want to see from a consumer or patient perspective?
Okay, so let me use a very concrete example that I would like to see. So people that have acute cardiac events, heart attacks. So these people, they had a certain lifestyle, right? So these people are, I don't know, I'm gonna pick a random one, not to pick on anyone, but you have, for example, bad eating habits that made you obese, and you were okay with that. You grew up with that. You have been, I don't know, 30 years eating a bad diet, and that led you to a very hard and acute event. You were close to death. That patient, let's call it a patient after the acute event, that patient changed. So it's not the same person. It's not the same consumer that you were before you had that acute event. Yeah. And the behavior change that I want to see is that how, with all the data points that we have from this patient, how we can provide them with an experience, an engagement experience, keep them engaged to improve and change their lifestyle. Yeah. And we can do it today. Look, we do it in TikTok, we do it in Instagram. These apps are designed to keep you engaged and looking into these social networks. There is nothing wrong with it, but the technology is there to help patients to change behavior. These companies have been able to get us hooked up hours in it, and they do generate ad revenue. There is no reason why we shouldn't be using similar or even augmented technology in the same realm to drive healthier behavior for these people that went through a very acute event. Now they want to change their lives, but it's not easy for them. Some of these people, they just, they work very long hours, or they work very tough jobs that are highly demanded. We can measure that. We can see that they get home, very tired, 8 p.m. after a long day of very hard work, and we should be able to influence them and get them to a different stage. How we can help them to improve the diet, yeah, to the example that I used them before. How we can help them to do some kind of exercise. So like, some exercise is better than nothing. And that's something that we're not doing today. And I feel that the future, the near future for us as humans, is going to go into that direction. It's going to go from just doing diagnosis and treatment in hospitals to engage with patients after acute events at home and help change their lives for better. And we're all going to benefit from this, because what this means ultimately is that healthcare costs are going to go down, because the risk of readmission is going to be less. And it's super exciting. Really, to me, is not only exciting but also moving, because when you do interviews with these patients, they know they want help. They know they need help. We're just not doing what we need to do for them.
So what is data-driven marketing's role in this change that you want to see?
So we need to find ways to, like I said at the beginning, go very deep on understanding these patients or consumers, and make sure that then when we think about value propositions, that with the data availability that we have, we need to make sure that we incorporate all the data points that are around the consumer of the patient. And this is something that we're not doing a very good job still. Everybody as a marketer, right? So I see that there is twofold. First is to spend more time with those niche consumer and patients that are desperately seeking for help. That specialization with these consumers and patients, I think that's something that we can do a better job understanding those. It's not only about the big, Gen Z, for example. Everybody's talking about Gen Z. There is a lot of companies that are going to focus on this. I think we can do a better job to understand the consumers and the patients in those niche segments, and we are not doing a good job with that yet. I see some pockets of expertise on that, but we haven't done that very well. And then the second piece is that when we think about value propositions, how we create new value propositions for patients and consumers, we need to think about this from a different angle, right? Right now, it's not only about a product, it's not only about a service, and I think the AI push is going to help us to go into that direction. Is what are the use cases where we can use data that is being generated by the consumer or the patient to improve that engagement, to have a positive impact in people's lives. And like I said, I think that's something that we are not doing a very good job yet. But I feel that very soon, in the next, I don't know, 5 years, we're gonna see dramatic improvement on how we marketers interact with patient or consumer data, or I would say patient and consumer generated data.
So I like this idea. It's exciting to hear you talk about it with such passion, and you talk about the next 5 years. So help me visualize what that might look like. I'm not asking you to solve the problem technically, but what might it look like this time next year? What might it look like in 2 years' time? You talk about consumer generated data, you talk about advertising data. Are you seeing a place where we open up our Fitbits and our Apple Watches and information about our diet to advertisers? Or obviously there's GDPR and privacy. So I'm excited about your vision, but there are some clear hurdles there. So without wanting you to come up with a solution, I'm assuming we can get around those things. What does the future look like? Are we going to see bespoke products advertised to people based on how many steps they've taken or what they claim their diet is? Or help me understand the future that you see.
Yeah, so this is the way I see it, right? So I see, and let's pick again an acute event, because I think that's the most dramatic change, that you were a consumer, you had an acute event, and now you're a completely different person. Yeah, so you are not anymore a healthy person. Let's pick that one because that's very concrete. So I think what's going to happen in the future is that you, as you want to change, you're going to give consent for marketeers to get access to your health condition. And then what's going to happen is that as soon as you walk out of that hospital, you will give consent for us to get access to that data. Maybe not to every company, but some companies will get access to that data. And with that, we're going to be able to communicate with you in a way that is much more relevant to you, in a way that is just in time with you, and in a way that will keep you engaged with that behavior change that we need to do. And let's make it even more concrete, right? So today you have a heart attack, you get sent home. The first 30 days, the hospital is looking for you. Usually that's true in Europe and the USA. After 30 days or after 90 days, depending on the situation, you are completely on your own. Yeah. So you are technically not a patient anymore because they are not taking care of you anymore. But then you are not the same person. There is no reason why we shouldn't be talking to you with products and services that are going to help you get that life improvement that we all will benefit from. Yeah. And yes, we need to get hurdles not only on the GDPR or HIPAA in the US. Yes, we have big companies like Epic, that is the biggest electronic medical record company in the world, that have siloed data that is very relevant to help to tailor that communication to the patient or the ex-patient after that. We really need to break those silos, but the benefit is for all. I don't see a reason why Epic shouldn't be opening up, obviously with the proper consent from the patient or the ex-patient, that those data points to everybody else, as long as they're used in the right way. Yeah, and I think that's where companies will differentiate. And let's pick examples. So, for example, I see Google Health. Google is trying to make an effort to go into the health sector, but most of the revenue comes from advertisement. So I find that super difficult to buy in, also for patients to give the data to Google. So I see players that are much more responsible, and maybe some of these players don't even exist today. There might be startups that are coming in that will make sure that they curate that communication. What they talk to you, the way that they communicate to you, the products and services that they offer to you are more specific to drive that behavior change. Yeah. And that's the way I see it in the future, in the very near future. So you won't be bombarded with all type of crap that you are these days bombarded, but it's going to be a much more curated experience for some.
Leandro, I'm sorry, but we have to end it there. I could happily talk more about your vision for a very long time, and thank you for sharing it with us. So if someone wants to get in touch with you about this topic or anything else, where is the best place to reach out to you, and what makes a message that you will actually reply to?
So if you want to reach out to me, I think the best and fastest way is through LinkedIn. You can find my LinkedIn profile, Leandro Chique. And you send me a message. I'm happy to do networking and happy to spar on my ideas too. I don't have a crystal ball, and I also usually have very interesting conversations with multiple people in the space. So feel free to reach out anytime, and we'll engage.
Leandro, thank you so much for your time.
Thank you for having me, Tom.
Hi. Just before you go, I'd really appreciate it if you could take the time to write a review of the Shiny New Object podcast on Apple Podcasts or iTunes, whatever it's called these days, or whichever podcast provider you use. We're an indie podcast, so it would go a long way for us if you could just share the word and give us a bit of a support on those channels. That would just be fantastic. If you haven't got time, that's also cool. And yeah, if you could tell your colleagues about the podcast, and also, if possible, don't forget to subscribe. And I'd love to hear your feedback. If you'd like to speak on the podcast or be a guest, or you think I'm asking the wrong questions, anything, I'd be super interested to hear what you think. So please email me at tom@automatedcreative.net. That's TOM at, I'm not going to bother spelling it. Anyway, you'll work it out. Thanks so much.